Have you ever wondered why some children and adults in parts of Africa have small scars across their abdomen? These scars are not always from accidents or surgery. For generations, they have been part of a traditional healing practice believed to treat an enlarged spleen. This condition is commonly associated with malaria in many African communities. Today on AfroHealthBridge, we explore this tradition with respect, science, and compassion. Among the Esan people of Edo State, Nigeria, this traditional practice is called Uvinmi, meaning to make incisions with a sharp object. It has traditionally been used to treat a condition locally called ude, which people believe is a disease affecting the spleen. Traditionally, the spleen is believed to hold and maintain blood. When diseased, many believe it develops a lump that draws blood away from the body, causing fever and weakness. To remove what is believed to be bad blood, the healer makes small cuts across the abdomen before applying herbal medicines. This knowledge is passed down through generations. Scarification is not unique to the Esan people. Across Africa, similar practices have historically been used for healing, cultural identity, beauty, and spiritual protection. In many rural communities where hospitals were once difficult to reach, traditional medicine was the primary healthcare source. But what does modern medicine say? Modern medicine explains that splenomegaly simply means an enlarged spleen. The spleen sits on the left side and helps filter blood and support the immune system. Importantly, splenomegaly is not a disease on its own. It is usually a sign that another illness is affecting the body, most commonly malaria in tropical Africa. Repeated malaria infections force the spleen to work harder by filtering infected red blood cells. Over time, this extra workload causes the spleen to enlarge. Unlike traditional scarification, modern healthcare first identifies the exact cause using physical examination, ultrasound scans, and laboratory tests before deciding on treatment. Research found that many children who underwent scarification did not actually have enlarged spleens. Medical experts warn of complications like infections and severe bleeding. However, this does not mean traditional healers intended to harm patients. Their knowledge developed over centuries to help their communities long before modern diagnostics. The discussion goes beyond whether abdominal scarification works. It also raises important public health concerns, starting with the risk of infection. In some traditional settings, the same blade may be used on several patients without proper sterilization, allowing bloodborne diseases to spread from one person to another. Another concern is delayed medical care. While decisions are made with love, seeking traditional help first may delay the diagnosis of malaria or severe anemia. Early diagnosis and prompt treatment of malaria can prevent complications. Unfortunately, many still believe enlarged spleens are caused by bad blood rather than malaria. Another important issue is child safety. Children cannot make decisions for themselves, and every child deserves safe, evidence-based healthcare to avoid unnecessary stress and pain. But this conversation is not about condemning African traditions. It is about learning from our history while embracing scientific knowledge that helps save lives. That is why many public health experts recommend partnership instead of conflict. Healthcare programs work with traditional healers to recognize danger signs and encourage early referral. Researchers recommend stronger community education, malaria prevention, and awareness campaigns to reduce unnecessary scarification and improve health outcomes for everyone. Health is shaped by culture, history, and lived experiences. At AfroHealthBridge, we believe Africa does not have to choose between tradition and science. We can build bridges. If someone develops persistent fever or abdominal swelling, please seek medical attention as early as possible. Early diagnosis can save lives. Thank you for watching AfroHealthBridge. Please like, share, and subscribe so more families can benefit from reliable, culturally respectful health information. We'll see you in the next episode.